Nilikuja kujijua niko HIV positive kwa na mimba ya third born. Nilisikia uchungu mingi sana. Mimi niko na mzee hana. Nilifikiria kununua dawa ya panya, mimi nikunywe, mimi nikufe.
Iliponianza hii ugonjwa wa TB, mimi mwenyewe nilianza kama nasikia joto usiku wa manane. Kozi nayo ikazidi na jasho ikazidi. Na hizi sehemu nikawa nasikia maumivu kwa ndani. Unaona? Basi kuna jamangu akaniambia bana, labda umekanyaga waya.
We also had challenges with the human resource because the county could not be able to employ all those who are working in the HIV department.
So there was a lot of stigma and devota from the patients.
Hapa hakuna gari, utaenda na mguu. Kufika hospitali inakuwa ngumu. Saa nyingine unafika kama umechelewa.
If CHS had not intervened, we'd be talking about a big number of community infections for HIV, a big number of deaths, even the mother-to-child transmission of HIV would have been very high.
CHS is a local organization that is proudly Kenyan, and really at the heart of it, we are about service to communities and a commitment to excellence in the work that we do. And this ranges from the 6 pillars, including service delivery, human resources for health, leadership and governance, medical commodities, health information system, and also health financing. But out of that formation, our forte has been largely HIV treatment, TB treatment and control across the country, and also health system strengthening.
When CHS came in, they were able to support us in terms of infrastructure and also in human resource.
We were able to transition from that small room to a big complex that carries all the units, and if there is anybody who appreciated the building, it was the patient.
Most of us were trained, all the service providers from the clinical officers, the adherence team, and then the nurses, and equally the HTS providers. And CHS equally availed the tools initially that we never had.
Started having these sessions, the eco sessions, way back 2 years ago. I've been able to benefit from it. We've had various discussions on different topics, and actually I would even request them to have more of the trainings, especially the online, because the online trainings we are able to multitask in that we are able to be at work at the same time. We are able to continue with our daily activities as we also attending the trainings.
We work closely with the counties and the government and of course the communities that we serve to prevent transmission of HIV from mothers to their children. And at the stage we are in is called now EMTCT, which is elimination, not just prevention, but elimination of mother-to-child transmission of HIV.
Senye nilishikana na CHS, at least waliniinua mahali. Wakani encourage, wakatuambia kuna future. Mnaweza get watoi, yenye sikuwa naamini ati naweza get mtoi asikuwe na hii virusi. So hapo ndio nilijitolea nikakuwa mentor mother, ndiposa nisaidiwa mama wale wengine. Up to date mzee ni HIV negative na mimi ni HIV positive.
This model of community RT, it was brought by the CHS team. Since they brought that idea, the number of clients attending the facility has reduced, giving the clinician or the nurse time to attend the clients with the issues.
Hizi groups za kijiji zimetusaidia, zinatusevia time. Ana spend almost 10 minutes. Ni kukuja tu unapick na unaenda.
CHS wametusaidia because they gave us bicycles. So we go with bicycles. We also have bags for carrying drugs. We have the registers, and when we go to distribute, we document, and then we come back, we give the distribution to the pharmacy.
The lab was operating not optimally. Our utilization rate was very low initially. The result turnaround time used to take more than a week. And now, courtesy of CHS, we are able to give results at least averagely in 2 days. And that's really helped when it's come to management of the client.
Center for Health Solutions has been able to support the transportation of samples from rural facilities to this expert testing site. So in this period, we've been able to transport over 1.3 million samples. We've also been able to ensure that approximately 650,000 drug-sensitive TB patients have not only been diagnosed, but also been initiated on treatment.
Waliniambia kwamba bana, wewe kitu ambacho uzingatie ni dawa. Tiba tunakupa bure ili uendelee na shughuli zako vizuri. Nikasema asante sana.
Globally, about 1 million children suffer from tuberculosis, and this was also the case in Kenya and continues to be, but through TB Act support, we worked with the Ministry of Health, one, to engage the stakeholders that were dealing with the childhood illnesses in general and who had not been engaged in TB work. But also pediatricians are more aware of how they can ensure children they think have TB can be treated, how they can link them within the system, and how those can also be reported.
We had challenges, especially with missing data or even transcription errors, and we had a whole wall full of files.
Since CHS came in, they have been very good partners to us. They have helped us move our patient medical records. We were the first facility in Lower Eastern to go completely paperless by March last year.
Recently, they even upgraded us to Kenya EMR. Kenya EMR is even more seamless, more smoother, and it even requires very little hardware.
Naishi project implements a comprehensive HIV prevention and treatment program. We take care of a group of people called the key populations. We realize that this a group that at times are criminalized, and we have to work with the administration, we have to work with the judiciary, the law enforcement arms to ensure that we are able to provide the interventions to the key populations without them being harassed by the system.
Hapa ndaizi wanatusaidia kupata PrEP, PEP, condoms, lubricant na family planning. Services zao ziko mzuri kabisa. Hata kama uko na shida, wanakuja wanakuongelesha kwa upole, hata we mwenyewe unajihisi umefika mahali inapostahili.
As a county, we have been really having a big gap in sexual gender-based violence, and now we have been able now to form the county sexual gender-based violence technical working group, and we are now getting report on what is being done to them in the county.
The collaboration with the CHS has enabled us to provide that universal access, because in about 80% of our facilities, Kenyans can access HIV services.
CHS has been one of our great partners in ensuring that we end TB in this country. We share the same vision, share the same goals and aspirations, and they come in to complement and fill in the gaps.
I have worked with the other partners who would come and give us the work to do. But CHS comes, you make the strategies with them, and they work with you. They are not the boss. They work with you. They move with you.
We have had, partners, donors, stakeholders who have believed in us, who have supported us, who have defended us, and continue to do so. And we are truly, truly grateful to our stakeholders. I must say that without our stakeholders, without our donors, we would not have been able to do any of this work.
We appreciate them. We are grateful on behalf of the community that we serve for their support, because it has been selfless, it has been sustained. Even in the face of COVID, our patients have not suffered because of the flexibilities within the program.
One of the main objectives of Center for Health Solutions is to provide a world of healthy families through innovative solutions, through evidence-informed interventions.
CHS as a program has allowed us to introduce new ideas. They really embrace ideas from individuals within and even outside. With that, the barcode has come out very clear because of the support that we were able to listen to what we are having in our minds.
We've come up with what we're calling a CHS barcoding model. There's 100% of data accuracy, because what we actually have on the EMR platform is actually what goes to the testing lab. So chances of transcription errors are actually reduced, and we get more timely and accurate data to the testing lab.
CHS imeintroduce Heroes App. Heroes App ndio entail lot of things, starting from adherence, retention, suppression, viral load follow-up, pill reminder.
They are able to interact with one another. They are able to access educational materials and prevention messages through the app.
Previously, we were using Excel sheets to collect data. It was necessitated to come up with a system within the M&E department that will enable us to be able to capture this data in a more efficient manner. So we developed CRIS, which is a CHS reporting information system used across CHS Tegemeza, CHS Shinda, and CHS Naishi. So what we do is that CRIS captures only aggregate data. It does not capture patient-level data, and it caters for both patients that we are seeing in the facilities that we support, and as well for key population patients.
So when we started, our development partner was one, CDC. But around 2012, 2013, because we knew we were fairly well grounded, we went out and applied for some other grants. And we got funding from the United States of America through USAID. Our first grant was $470,000 US. The 10 years journey, CHS has managed $196 million US. That's not some little money, but we have managed that so well that it is a manifestation of foresight. It's a manifestation of planning. It's a manifestation of strategic thinking.
In the latest NGO board report on not-for-profit organizations in Kenya, CHS was ranked as the 5th highest funded in Kenya. It was also ranked as a 4th best in utilization of resources for programs and the top in HIV programming in Kenya. The story of CHS is really a story that, is really a story of continuous improvement. It's really a story of humility and service, and a story of consistency and a never say die attitude. We have redesigned an acute care system to a chronic care model where long-term follow-up is a forte.
Mwanzo nataka kusema CHS ni watu wa maana tena sana. Wamesaidia wengi, nikiwa mmoja wao. Wamesaidia watu sana.
Kwa hivyo wazidi kutuongezea na dawa na wazidi kutuongezea na wahudumu na services ambazo wanatupa, wasije wakapunguza hata moja, kwani ndizo nyingi zimetuwezesha kuishi kama ninavyoishi mimi.
Our life are prolonged because of their supply of drugs and their support through our treatment.
I appreciate on behalf of the hospital that you even put up the complex that will remain forever in this institution, and CHS will remain in Nyahururu Hospital forever.
CHS built us. CHS made most of the staff that we have learning the CCCs what we are today.
The sky is not the limit. The CHS has a big and bright future.
I enjoy serving at CHS because of its impact in terms of reducing the HIV and TB burden in the country.
I enjoy serving at CHS because my work impacts millions of Kenyans in the 47 counties.
I think if we've done that this far with CHS, imagine how far we'd go if it was even more than 50 years.
The problems that require solutions are very many, and therefore Center for Health Solutions should be in business for a long time to come.
Happy 10th anniversary CHS. Happy 10th anniversary CHS. God bless you.